cardiovascular disease, kidney disease. How likely is it that you'll fall asleep sitting at a stoplight? How likely is it you'll fall asleep watching TV or reading? We can use, there's certain types of positioning pillows we can use.
Hi, everybody. Welcome to the Kidney Coach YouTube channel. I'm naturopathic Dr. Fiona Chin, co-founder of the Kidney Disease Solution and head formulator at Kaigenesis. And I am so thrilled today to be joined by the amazing Dr. Ellie Campbell. So let's dive in. So let's talk about this oral hygiene. And of course, people listening are going to have kidney disease, but as we know, cardiovascular disease is the second leading cause of kidney disease and changes in kidney function. And sometimes we have patients where you can do everything left, right, and center, and you can't quite get the blood pressure where it needs to be. Or it sounds like if you're not really treating this driver, you're still going to have changes in blood vessel health and endothelial health. So let's dive in.
Sleep apnea is a hugely underdiagnosed and underappreciated trigger for high blood pressure, cardiovascular disease, kidney disease, and stroke. So it leads to oxidative stress. It leads to inflammation. It leads to spiking cortisol levels that can burn our body out over time. So we don't want sleep apnea. Not everybody that snores has sleep apnea.
No.
Not everybody that has sleep apnea snores.
Yeah.
So we have to have a very high level of suspicion that the patient may be suffering. Ask them questions. Do you wake up rested and refreshed in the morning? How likely is it that you'll fall asleep sitting at a stoplight? How likely is it you'll fall asleep watching TV or reading a book at the end of the day? How fatigued are you? Does it feel like you run your life by walking through molasses? Right? If you're fighting through it and doing your day, but you're so overwhelmingly fatigued, get an evaluation for sleep apnea. It can save your life and it can prevent a devastating heart attack, stroke, or the need for dialysis. Now, one thing I wanted to make a point about sleep apnea. Many patients are reluctant to do a sleep study because they believe that they are so claustrophobic they could never wear a CPAP mask.
Gotcha.
Right. And so they say, I won't do the test. I'm just not going to do it because I won't do the treatment. I just know it. I would smother. It scares me. I can't do it. They don't know that there's other treatments for sleep apnea besides CPAP. And I'll tell you two of them. The first one is super simple. It's positioning. It's if we do the sleep test and we find out that you only have apnea when you lay on your back, we find a way to not let you lie on your back, right? And that's one way is a little backpack with an inflatable ballast that you put on after your pajamas. You blow up the little pillow and you can't roll onto your back because there's a pillow in the way, but it's in a backpack. So you can sleep on your side and it won't bother you. But as soon as you try to lay on your back, it will be impossible. We can use, there's certain types of positioning pillows we can use, but it's simple positioning. Also, many people with mild sleep apnea can get away with mouth taping. Yeah. Mouth taping is a thing. I love my mouth tape. I will not travel without my mouth tape. I will not sleep without my mouth tape. I love my mouth tape. I unfortunately grew up in a day and age when it was standard practice for us to remove 4 teeth and put us in headgear for orthodonture. So they pulled 4 perfectly healthy teeth. I had an overbite. They put me in this headgear that I wore that smushed my whole face backwards. And that was a beautiful way to get me straight teeth. And I was very happy to have a pretty smile. What I didn't know was they removed 15 millimeters of space for my tongue, pretty well guaranteeing that my mouth would be too small. And later in life, if I gained any weight at all, which we mostly do, then I didn't have enough room for my tongue. And I developed sleep apnea as an adult because of the treatment that I'd had as a teenager. So now I am wearing my second solution as an oral appliance. My dentist, my enlightened dentist, has fitted me with a dental appliance that has a little key. And about every 5 days, I turn the key and it cranks open. It's literally growing me a larger jaw. Both my lower jaw and my upper jaw are becoming larger. So now I have room for my tongue. It sits in the roof of my mouth, and I tape my lips closed at night. I no longer snore. I no longer have sleep apnea, and I don't have to wear a CPAP mask.
Thank you for being part of our audience. And Dr. Campbell, thank you again for your wisdom, your time, and pioneering the way in just helping people live better, healthier lives.
You're so welcome. It's my honor.
All right, everybody. We'll see you next time. Thanks again. Bye.